Assembly Bill 1787 would establish an annual reporting deadline for local health officers to report cases of valley fever to the California Department of Public Health. With the amendments would improve communication between California Department of Public Health and local health departments while establishing the deadline for the Department of Public Health to aggregate the data. Local health officers are required to report cases of valley fever to CDPH. I think I've talked to almost every member of the committee about valley fever and kind of what it's meant not only to the Valley, but just to residents across California. We know that 50 out of the 58 counties do have reported cases that they reported. We know that the CDC Center estimates that 150,000 cases go unreported every year. 60% of the people that have valley fever don't know that they have it. We know there's no vaccine, there's no cure. What we're trying to do is really trying to help all of those families that are deeply affected up and down the entire state, and would appreciate an aye vote.
As Assemblyman Fong said, my name is Robert Purdy, and I'm a 6-year survivor of the valley fever, meningitis form of valley fever. I am one of the members of a family that was deeply impacted by this disease, as Mr. Salas said. I have been actively working to increase awareness and resources for valley fever since I recovered my health enough to do so. 18 months ago, I joined the Valley Fever Americas Foundation, and in January, I was elected vice president of that board. Valley Fever Americas Foundation is an all-volunteer foundation that evolved from the Rotary International Valley Fever Vaccine Project in the late 90s. For 20 years, we have supported a vaccine for valley fever, and over time, our mission has expanded to include seeking a cure and community awareness. We have taken a strong position of support on all the valley fever bills because we believe they offer smart, measured improvement. AB 1787 specifically improves the flow of information between the state and counties by requiring, for example, that changes made by the state to the numbers reported by the counties be communicated back to those counties. The greater the variance between state and county numbers, the less weight and attention they will be given when this body or any entity reviews them. Accurate numbers begin with good guidelines, and that is what AB 1787 strives to create.
Mr. Chair, this is part of the Valley Fever package. Assembly Bill 1788 addresses the lab testing. One of the things that we found out when we were delving into all of this was, for some reason, when you test positive, a lab test positive for valley fever, it wasn't counted by the California Department of Public Health, which is why CDC says over 150,000 cases every year go unreported. So one of the things we wanted to do was to correct that so that we can get the resources dedicated towards valley fever that we need. So what this legislation says is once you test positive for valley fever through a lab test, then we're going to go ahead and count those numbers at the Department of Public Health. We've seen other states like the state of Arizona move to this model. It's 97% accurate in the state of Arizona by moving to this model. For some reason in California, we require additional steps and I would say barriers to actually counting valley fever cases, and this legislation seeks to address that and correct those issues.
And I'm here in support of AB 1788, which would remove the clinical confirmation requirement for accountable diagnosis of valley fever. Currently, the state requires all labs to report positive valley fever tests, but only counts those that have a clinical confirmation. Removing the clinical confirmation will actually increase the accuracy of the case count for valley fever. For California, in the counties most affected by valley fever, the amount of follow-up necessary to clinically confirm valley fever is insurmountable. In 2016, for all of Arizona, there were approximately 23,000 valley fever laboratory tests. In 2016, in Kern County alone, that number was almost 20,000. In the counties most affected by valley fever, the clinical confirmation requirement takes hours upon hours to accomplish. In the counties least impacted by valley fever, the problem is different. I had a conversation in January of this year with a friend of mine about a county that was reporting one case of valley fever, where he personally knew and recalled being aware of half a dozen cases in that same county. California has required labs to report valley fever since 2010, and they do a good job of it. Removing the impediment of clinical confirmation will actually increase accuracy and allow a more accurate count of those of us suffering with this disease.